I'm thankful to have you here today to sort through some of the questions we have lingering. And one of the big areas that we still have to talk about when it comes to COVID-19 is testing. Now,
Yes.
I remember when everything was first coming out, when the pandemic was hitting our communities first. Testing did not seem widely available at all, and it was kind of a scary time, right? Where you would
Right.
have some symptoms, you didn't quite know what to do about it, and there weren't a ton of resources to be able to find out. Now it seems like that's changed, and that tests are more available than they were previously, which is good, but also leads to some questions because there are different types. There are different situations when you should or should not get tested. So that's why we wanted to have you back today to sort of sort through all of that and see where we're at right now when it comes to testing.
Yeah. And as you mentioned, I live outside the Chicago area. Testing is readily available for us. We had a little bit of a peak, unfortunately. So it was a little bit iffy in getting testing, same day testing, I would say a couple of weeks ago. But as of the past couple of days, it seems like that is back available to us. So it kind of depends on where you're at in the country, but overall testing is widely available. So we still have the antibody test, which people can get the antibody test. This is not going to show if you have an active infection or not. It's just going to show antibodies to previous COVID infection or therefore like infection. So I'm still hearing some of that, but the big test we've been hearing about is the rapid test and then the PCR test, which they are a bit different. So the rapid COVID test is also called an antigen test. And basically it detects proteins from the virus, which causes COVID-19 or SARS-CoV-2. So this is an accurate test in individuals who are experiencing symptoms of COVID-19. The benefits of this test, it allows it to be caught earlier so that contact tracing can be started earlier and hopefully reduce transmission. And then we have a PCR COVID-19 test. Now this test is going to be our gold standard. So this is a molecular test or polymerase chain reaction test. And basically it detects genetic material specific to the virus that causes COVID-19 or SARS-CoV-2. Again, it's the gold standard in detection, and it is going to be more accurate than a rapid test. The disadvantages with this test is that it can take a little bit longer to result. Ideally, you'd like to see it within 24 hours, but I know a lot of places, just because of backlogging and administering so many tests, it has taken, one of my daughters had one and it took like 5 days to get back. So that's the problem with that one. It's a great test, very accurate, but just that waiting time is a little bit of a hindrance.
That makes sense, and I guess it's built into the titles of the test there too. You've got your rapid tests, which as it sounds, is going to come out more quickly. But then you've got the PCR test, which takes a little bit more time, but might be a little bit more accurate. And I know I've signed up for testing, and it can be a little daunting when you get to the list because they'll give you these options up front. You're not quite sure which one to choose. Sometimes you've got a bunch of fields to figure out, and it can be a little overwhelming when you're planning ahead. So, other than the timelines involved, is there any reasons why someone might choose a PCR versus a rapid test and vice versa as far as situationally?
So that's a great question. Again, the PCR test is going to be the gold standard or the most accurate test to show if there is a positive infection. A lot of times that will be guided by whomever is sending the individual for the test. So school districts, employers, they may have specific guidelines that they want you to follow. And a lot of times at these testing centers, they're going to run both. And kind of like strep throat, as a nurse practitioner, I can speak to this. They've got a rapid strep throat test and then they'll send one away. And I've had this with my daughters too, where the rapid will show up negative and then they'll call the next day and say, oh, it was positive. So it's kind of the same thing, right?
Yeah.
Where you're actually getting a better look with the PCR test. I hope I didn't confuse you with the strep throat, but just saying that this isn't like something that's new.
That is a great example because as a kid, I got strep throat all the time. So I was very used to that process.
Test and then one that they would send away to the lab, right? And sometimes it would show different results, but you went with the one that was sent away would be the more accurate one. So the PCR test is always going to be the gold standard. Again, a lot of times it's going to be basically whoever's sending you. Also can go with signs and symptoms if you were exposed. Certain countries for travel will want a certain kind of test. So look into, I guess, the reason why the test is being administered, and then also your signs and symptoms. And of course, take into account public safety is going to be number one. So we definitely need to be responsible as individuals and as parents and whomever we're taking care of, if we're taking care of elderly parents or whatever, and make sure that we're doing our part too to keep the public safe.
Those are all great points, and it's a great reminder to always be aware of the requirements, for anything, any sort of travel or an event you're going to. A lot of times they will detail which specific test you should be getting, and that's also important because if you don't have that many places to get a test in your area, sometimes those schedules can book up, and if you need something that week, you might not be able to find a slot. I know I've run into that before when trying to get a rapid test, and maybe only the PCR are available, and you don't have that 3 to 5 day window to wait on. So
Right.
being prepared up front and having that thought of what the timeline might look like and what's required for my event can make a big difference. So
Absolutely.
I love that as a guideline. And then something I did want to bring up, I feel the need to, is that I think when I first started looking at testing, I was a little freaked out by the process of it. And I know that originally when, I was seeing images and explainers about how the tests work, I saw someone, in medical gear, a face covering and everything, kind of administering, a swab into the person's nose, and them having to take it in, and maybe reacting poorly to that process. Is that still the way that this is going? Are professionals on site administering the tests, or are they shifting to more of a self-administered process for that at all?
Yeah, that's a great question. So I can only speak to the experiences that I've had, but I have seen the nasopharyngeal, the test that you were referencing, where they go way up there, very painful. I have not seen that done recently. So when we've had tests that had to be tested recently, literally my little girl, I will do her test just because I kind of want to do it anyways, right?
Sure.
So they give me the testing swab, and it's a Q-tip. So imagine going about an inch into the nasal cavity, twirl it around 10 times on one side, 10 on the other. Then my older daughter, she can self-administer it herself. So every place that we've been tested recently, I've done it, or my daughters have done it themselves. So it does seem like they are going away from the more invasive type testing. Now, what hospitals are doing, or, in ERs, I can't speak to that, but
sure.
In the community, that's what I've been noticing.
That's true. I mean, I like to know that a test is accurate and effective, but if the process can be a little bit more comfortable, a little bit more accessible for everyone, I'm always a fan for that. But you're right. I will take whatever advice that a healthcare professional is going to give me about the best way to go about it. And I hope I don't sneeze on anyone, because you could have a reaction to something going in your nose like that. Okay. Well, we've covered here the different kinds of tests, when you might want to consider getting them, and then the process in general that you'll encounter going to a testing site. Whether that be going through a questionnaire and then having to administer the test yourself as well. Are there any final thoughts you want to share when we're talking about testing? We're looking ahead at the colder winter months here and everything, and as we go to more indoor events, and folks return to work maybe in a hybrid way, it seems like there may be more testing required of us as we go through that. So are there any last considerations you want to share with our audience as we talk about COVID testing?
Yeah, I definitely would say always keep public safety in mind. Remember that this could be, and I know so many people, so many Americans have been impacted by this in a really harsh way by losing loved ones. So remember that the virus does not discriminate. We're losing younger people now. It's remains a very, very bad virus. It's deadly. So if you feel ill, get your test, stay out of work, stay away from people, make sure that wear your mask, wash your hands, get vaccinated, do your part to keep everybody else safe and your family members in your community, of course.
Yes, continued great advice. And to me, it reminds me of when they say something is part of a healthy breakfast, and they show you not only the cereal but that you've got your, apple and, some juice and, whatever else is running out. It's not just one thing, right? You're not
Right.
just getting tested. You're not just doing a vaccine. You're not just maxing. It's this whole, comprehensive plan to make sure that we're keeping each other safe, and testing is one part of it that hopefully is more readily available for everyone now, but
Yes.
needs to be taken in concert with a few other steps.
Yes, absolutely. Absolutely.
Well, thank you again for joining us here.
Yeah,
It's so
fun.
great to have you on and to share the expertise here, because I know it can be confusing as things change, and as we learn more about COVID-19 and how to protect ourselves and others. So thanks for talking about testing today.
Yeah, thank you for having me. Bye.
Bye.